Bismillahirrahmanirrahim. Assalamu alaikum. I'm Hidna Iqbal, lecturer at Center for Clinical Psychology, University of the Punjab, Pakistan. I am also practicing clinical psychologist over there, and I'm here today presenting my research thesis, which was done under my supervision by my student, titled "Personality Hardiness, Spiritual Intelligence, and Stress-Related Growth in Individuals with Physical Disability." So before starting, I would like to share some statistics from the World Health Organization that shows that 500 million people in the world who are disabled in some way they are disabled, and 80% of these individuals live in developing countries like from Asia, Africa, South and Central America, and Middle East. Some stats from Pakistan, a research done by Pakistan Poverty Alleviation Fund in 2012 showed that 8 out of every 100 Pakistanis are with some degree of disability, and 1 out of 130 persons has severe disability, and most of them have multiple disabilities. So we wanted to see some protective factors that were helping these individuals with disability to cope with this problem of their this disability, and how they are coping with this problem, and what are the protective factors that are helping them to cope with this stressor, which is ongoing, which will continue maybe for the rest of their lives. First of all, personality hardiness, it's actually a constellation of personality characteristics that function as a resistance resource in encountering with stressful life events, and it is actually an existential courage which helps them to face stressors and moving forward in their life, and it is something that can be learned throughout their life despite having stressful events. Then there is spiritual intelligence, which is a set of mental capacities that contribute to the awareness, integration, and adaptive application of the non-material and transcendent aspects of one's existence, leading to such outcomes as deep existential reflection, enhancement of meaning, recognition of a transcendent self, and mastery of spiritual states. And again, it is something very experiential, and it also acts as a protective factor towards stressful life events. Lastly, there is stress-related growth. Now, we chose stress-related growth and not post-traumatic growth because trauma is an event and it happens. However, a stressful event or a stressor is something that is continuous in nature and it keeps on going. So when we talk about disability, and specifically that sort of disability which is congenital or hereditary, it is a stressor for life maybe. So we wanted to see the stress related growth. That is why we chose this variable. Our aim was to see a relationship between these variables, and also to see the predictive value of hardiness and spiritual intelligence for stress-related growth. And obviously, it's a very this population, especially in Pakistan, is very underprivileged and discriminated and stigmatized. So we wanted to see what were the protective factors that are helping these individuals to move on and go forward with their life. And our findings would definitely help mental health practitioners and medical doctors and people who are maybe physiotherapists, people who are involved in dealing with these individuals, so that they may incorporate certain aspects of positive psychology and add these protective factors in while developing their intervention. Maybe it's medical or psychological in nature. The sample we chose were actually both men and women, and they were total 105 participants. Their mean age was 27.36 years, and they were selected from rehabilitation centers and some institutes that would giving them skill training and helping them to earn for their living. So we chose such institutions that were these individuals were actually enrolled in that institutions. There was a certain selection criteria. We wanted only those individuals who were having a disability in their upper or lower limb, and it was the nature was congenital or hereditary, like osteogenesis or spina bifida or polio, and both men and women were included, and the age range was from 18 to 50 years, which is quite a wide range. However, people who had additionally visual impairment or speech related impairment or auditory impairment, they were excluded, and people having some psychiatric problems were also excluded from the sample. This is the table showing major characteristics of the population. Mostly were men and had done their masters and belonged to Islam, and were living in a joint family system. The measuring tools were cognitive hardiness scale, spiritual intelligence, self-reported inventory, and stress-related growth scales. You can see the number of statements, and their scoring was on Likert point scale, and had good internal consistency, all three scales. But we actually, translated these tools into Urdu language so that the comprehensibility and the language barrier could be dealt with. The procedure was actually we sought approval from our departmental doctoral program committee. Then we sought permissions from all the authors to use their tools and to translate them according to MAPI guidelines. Then we sought permission from all the head of institutions from which we collected data. All participants who fulfilled the selection criteria were included in the study, and data was collected. However, certain ethical considerations were ensured, like we told them the nature and purpose of our study, and their rights to withdraw from the study anytime they want, and obviously no legal or medical rights would be violated if they wanted to discontinue. The response rate was quite good. It was 94%. Only some of the participants, they left the questionnaires incomplete, and some didn't give consent to participate in the study. So moving on to the results, this is actually psychometric properties of the major study variables according to the sample from which we collected data. Because we translated all these tools into Urdu language, so we wanted to see the alpha levels, that they were showing some internal consistency, and you can see the values are pretty good. They are ranging from 0.62 to 0.87, and it's quite reliable. So all translations were also adequate. This is a correlational metrics, and you can see that stress-related growth is showing high, positive, significant correlations with almost all variables. Like personality hardiness, it's showing 0.95 correlation, and some subscales of spiritual intelligence are again showing quite good values in the correlation, and it's all were positive and all was significant. So higher the personality hardiness, higher will be the spiritual intelligence, and higher will be the stress related growth. This is the regression model that emerged, and the R square value is pretty good again. It's 0.925%, and it's very strong, showing strong prediction from personality hardiness and some subscales of spiritual intelligence. And this was the emerged model. As you can see, the predictors are personality hardiness, critical existential thinking, personal meaning production, and transcendental awareness for the outcome variable that was stress related growth. So the findings which we discussed are actually supported by previous literature, as done some researchers by Joseph and Bettler in 2010. They suggested that between 30 to 70% of individuals who experience stressful incident, they come out of it with a positive change, and positive frame of mind. And personality hardiness is actually like a cushion, a bumper that helps them to be resilient and cope with the stressor, and reduce psychiatric problems like anxiety, depression, and negative thinking patterns, and maybe some health related conditions also. Similar results are found by Kumar and Pradeshwan in 2011, and spiritual intelligence actually, people having high spiritual intelligence showed low levels of stress despite having stressors in their life. And um, similar results were again shown by Angel and Nishi et al. In 2016, that personality hardiness and spiritual intelligence, they act as predictors for stress-related growth. Now, spiritual intelligence is about search for meaning of existence, finding meaning in every incident of life, and critically analyzing abstract concepts like existence of some spiritual power and individuals' relation to others, self, and universe, and the subscales of spiritual intelligence like personal meaning production, which means creating meaning and purpose in all physical and mental activities, and transcendental awareness, which is the ability to recognize higher dimension of self and world and others, and critical existential thinking, which is actually critically analyzing the nature of reality and existence. They all act as predictors for stress related growth, and similar results were found by King in 2008. And the belief on the existence of the superior power help the people to better cope and experience stress related growth. So as in one ayat, Allah says to us, to his creatures, that those who patiently persevere will truly receive a reward without measure. And that's indeed, it's that's the reference written over there. And obviously every research, be it an original work, it always has some limitations, and there is always room for improvement and suggestions for the upcoming researchers. I personally believe the sample size was quite small. Only 1 or 5 individuals could be included because we had certain stringent criteria, and we were time bound as well. Similarly, female participants were less, and we only included people or individuals having congenital disability. So we could not run, gender differences, or differences in people having acquired disability or people having congenital disability. There might be, differences in their results, and they might turn out to be interesting as well. So gender differences could be. I feel gender differences should be actually, explored in this scenario. So this is all from my side. Thank you so much. You can have my email address, and you can always drop in your comments or feedback or any questions you want to ask about this research, and anything you would like to maybe add, or any feedback, any comments. They're most welcome. And it's a pity we could not meet face to face, but may Allah bless you all and keep you safe and healthy in these times of crisis. And it was a pleasure to present here at this prestigious event, and may Allah bless us all. So Allah Hafiz, and take care.